I want the insanity to end. I remember the locking down of businesses, the locking out of school kids, the locking in of nursing home residents. I remember the overdiagnosis and the overpayments based on how many times you could get that diagnosis of COVID-19 onto your medical records. I remember what we did to nursing home patients and the lonely deaths they died. And I remember the goalposts being moved from flatten the curve and don't overwhelm the healthcare facilities to a point where this is never ending, but don't worry about it. The people in charge will decide. And I remember the mandates, the masks, the modeling. I remember it all. And I remember the epidemic of fear and the expansion of governmental power through the executive powers, emergency orders. And I remember the lack of transparency and the unwillingness to allow physicians to treat patients as they might want in that relationship with the patient-physician. And I remember immunization protocols and literally seeing a vaccine rolled out whereby it was like winning the lottery. Get a vaccine and we'll put your name in for the lottery. Get a vaccine and you might get a free college education. And I remember natural immunity being denigrated as if it hasn't been a microbiologic concept in place for centuries. And I remember what happened to soldiers. And I remember subordinating science at the altar of fear. So I want the pandemic over, and I want us never to make the same mistakes we did. Hi, Dr. Scott Jensen here with the Scott Jensen Podcast. Once again, I want to point out that we live in a time where, as George Orwell said many years ago, he said, in a time of universal deceit, telling the truth becomes a revolutionary act. Well, we're going to tell the truth, and sometimes it might be uncomfortable, and I appreciate you joining us. If you want to get the book I wrote, We've Been Played, you can go to drscottjensenbook.com. Today, I want to ask you a question. When a big lie cheapens our losses and steals our freedom, what should our response be? Recently, there was an article written by someone I'd never heard of. I would never have seen this article were it not for the fact that on a Substack that I participate in, the headline of this Substack was, "Can a headline be a crime against humanity?" And I thought, well, why is that question being asked? Can a headline be a crime against humanity? And there was a link. So I went to the link. And there was an article. And the article was written by Peter Sandman. And I don't know him. And the title of the article was, "Why I Hope the COVID Pandemic Isn't Over." And I thought, well, what do we have here? Someone just trying to get people to sign on and read an article? So I visited this Peter Sandman's website, and there's all kinds of links. I think he taught in the Harvard School of Public Health. He has this recent article, "Why I Hope the COVID Pandemic Isn't Over." And then I came across a link between Peter Sandman and the University of Minnesota with a branch of the University of Minnesota called CIDRAP, CIDRAP. And you might remember that's an agency within the University of Minnesota with Mike Osterholm, a PhD. And so I looked up, what is Peter Sandman's connection with CIDRAP at the University of Minnesota and Mike Osterholm? And it takes you to a page called The CIDRAP Viewpoint. Part 1, The Future of the COVID-19 Pandemic, Lessons Learned from Pandemic Influenza. I thought that's interesting. Part 2, Effective COVID-19 Crisis Communication. I want to read that again. Effective COVID-19 Crisis Communication, written by Peter Sandman, the person who writes this article saying, I hope the COVID pandemic isn't over. Let's talk about the article. Let's talk about what he says. He says, more dwindling before the pandemic ends would promote better health outcomes. I read that and I think, how is this not a big lie? We go into the article. This is a comment of Sandman's. President Joe Biden said the pandemic was over in September 2022. That's a year and a half ago. A March 2023 WebMD headline read, "It's finally time to stop calling it a pandemic." By June 2023, 64% of Americans had reached the same conclusion. An ever-growing majority of Americans are insisting that the pandemic is over. But he writes, if we're lucky, the pandemic is not over. Here's why. And he goes on with this section on deadliness comparisons. And he says, according to the CDC, COVID killed 42,670 people in the U.S. in the first half of 2023. Well, if you go to the CDC data, you'll find that in 2018, influenza killed a lot more than that. Some data would indicate approximating even 90,000, not 42,000. The fact is the CDC data will tell you that somewhere between this and this number for 17, 18, and 19 all had 40,000 deaths. So to me, Sandman has taken one number and trying to make a crisis out of it. Then he says, the CDC spreadsheet says flu killed 23,000 people in the U.S. in the first half of 2023. So now he's comparing the first half of 2023. He's saying COVID had 42,000, flu had 23,000. So you know what he said next. Yep. Basically, he's saying COVID is twice as deadly as the flu. But he's not talking at all about how many times we're testing for flu versus how many times we're testing for COVID. He's not talking at all about how many times it's being cycled in terms of the PCR test for COVID. Because if you cycle it an excessive amount of time, you can clearly get what Tony Fauci calls dead nucleotides as a positive test. He says experts are pretty sure the virus is not going to die out, and they won't be terribly surprised if COVID gets deadlier again. Where'd that come from? I've not read anything about that COVID-19 is going to get deadlier. The normal pathway for viruses is to mutate and become less and less virulent so that the host won't be destroyed. This is common microbiology. To me, what's happening here is Sandman is beginning the process of fear. And I've often said, fear constitutes fabrication, exaggeration, accusation, and then rinse and repeat. So here he's fabricating. He said COVID's going to get deadlier again. He's scaring people. Goes on, and he says, new and improved antivirals were what contributed to a rosy prognosis about the future. Well, that's an exaggeration. New and improved antivirals are still being hotly debated in terms of what they do to kidney function, liver function, whether or not they actually reduce hospitalization or death from COVID-19. So he's clearly exaggerating one fact that I don't think he really understands. Then he says, the chronic disease picture isn't so rosy. We don't yet know how bad or how long COVID will be. It's almost like he's accusing us that we've minimized long COVID. Well, you could say we have long mono if you want, because we see people who have mononucleosis and their convalescence isn't done in a month or 2 months. It sometimes lasts years. In the world of medicine, we've had hot debates about whether this chronic fatigue syndrome exists as a specific separate entity or if it's not a coalescence of all kinds of triggers that might cause chronic fatigue. He says seasonal flu is serious, transmissible, and widespread, but it's been around for centuries and we know what to expect. Friends, coronaviruses have been around for at least decades, if not centuries. COVID-19 isn't the first COVID, the first coronavirus. It isn't the second. We have at least a half a dozen coronaviruses circulating. And yet he's trying to take this and say the flu is predictable, coronaviruses are not, so we should be afraid. He said, we have to face a new normal with a brand new disease nearly twice as deadly as flu. There he goes again, right back as twice as deadly as flu. But if you actually look at the IFR, the infection fatality rate of influenza, and where COVID ended up being, we're somewhere in that range of anywhere from 0.1% to perhaps 0.3%. Most influenza may be 0.1 to 0.2. COVID may have been 0.2 to 0.3, but we're in the same ballpark. And then he goes on to close and he says, I'm hoping the COVID pandemic dwindles for a few more years before it ends. And that's why I hope the COVID pandemic isn't over. Rinse and repeat. Let me tell you why I hope this guy's wrong. I want the insanity to end. I remember the locking down of businesses, the locking out of school kids, the locking in of nursing home residents. I remember the overdiagnosis and the overpayments based on how many times you could get that diagnosis of COVID-19 onto your medical records. I remember what we did to nursing home patients and the lonely deaths they died. And I remember the goalposts being moved from flatten the curve and don't overwhelm the healthcare facilities to a point where this is never ending, but don't worry about it. The people in charge will decide. And I remember the mandates, the masks, the modeling. I remember it all. And I remember the epidemic of fear and the expansion of governmental power through the executive powers, emergency orders. And I remember the lack of transparency and the unwillingness to allow physicians to treat patients as they might want in that relationship with the patient-physician. And I remember immunization protocols and literally seeing a vaccine rolled out whereby it was like winning the lottery. Get a vaccine and we'll put your name in for the lottery. Get a vaccine and you might get a free college education. And I remember natural immunity being denigrated as if it hasn't been a microbiologic concept in place for centuries. And I remember government overreach. And I remember what happened to soldiers. And I remember literally subordinating science at the altar of fear. So I want the pandemic over, and I want us never to make the same mistakes we did. In fact, I think it's important for you to take a moment and watch this video.
We can and we will turn the tide on COVID-19. It'll take a lot of hard work. It's going to take some time. Many of us are frustrated with the nearly 80 million Americans who are still not vaccinated, even though the vaccine is safe, effective, and free. While the vaccines provide strong protection for the vaccinated, we read about and hear about and we see the stories of hospitalized people on their deathbeds among the unvaccinated over the past few weeks. This is a pandemic of the unvaccinated. The unvaccinated overcrowd our hospitals, are overrunning emergency rooms and intensive care units, leaving no room for someone with a heart attack or pancreatitis or cancer. This is not about freedom or personal choice. It's about protecting yourself and those around you, the people you work with, the people you care about, the people you love. My job as president is to protect all Americans. So tonight, I'm announcing that the Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated or show a negative test at least once a week. Some of the biggest companies are already requiring this. United Airlines, Disney, Tyson's Food, and even Fox News. My message to unvaccinated Americans is this: what more is there to wait for? What more do you need to see? We've made vaccinations free, safe, and convenient. The vaccine has FDA approval. Over 200 million Americans have gotten at least one shot. We've been patient, but our patience is wearing thin, and your refusal has cost all of us.
Doesn't that hit home? Doesn't that sort of reinforce concerns you've had? Do you remember when we heard people say, you take this vaccine, you won't get the disease, you won't transmit it. Then when that was found out to not be true, do you remember all the people who said, we never said it doesn't transmit. We never said you wouldn't get the disease. Watch this video.
That over 99% of COVID-19 deaths have been among the unvaccinated. 99%. This is an American tragedy. People are dying and will die who don't have to die. If you're out there unvaccinated, you don't have to die. Read the news. You'll see stories about unvaccinated patients in hospitals. As they're lying in bed, dying from COVID-19, they're asking, Doc, can I get the vaccine? And the doctors have to say, sorry, it's too late. Right now, too many people are dying, or watching someone they love dying and saying, if I just got vaccinated, if I just. It's heartbreaking. And it's complicated even more because it's preventable.
Exactly. This video is pretty compelling. Edward Dowd is a highly regarded individual who can do statistical analysis. And he comes out and says, excess death rates from cardiovascular diseases were flat in 2020, the first year of the pandemic, but up 13% in 2021 and 43% in 2022. I will leave it up to you to do your own thinking regarding why would excess cardiovascular deaths be up in 21 and 22. Dowd also reports that the rising incidence of cancer was 45% increased in 2022. Former presidential candidate Ben Carson had this to say in a moment of reflection and blistering candor. I don't know about you, but I was very disappointed with the response of the medical community to the whole COVID pandemic. They threw science out and cast their lot with politicians. They threw science out completely. All of a sudden, nobody knew what natural immunity was, even though we've been working with it since the Civil War. Friends, the atrocities that occurred from a policy perspective over the last 4 years should not be repeated. I don't know this PhD Sandman other than to know that his PhD is in communications, not a core science. I don't agree with him. I hope the pandemic is over. And I hope we never do what we did again. Thanks for listening. If you want to get the book that I've written, We've Been Played, it's available at drscottjensenbook.com. See you soon.